All righty, good morning, everybody, and welcome to From Beacon Hill to the 413. And for those who maybe have not joined but are joining for the first time, I just want to kind of give a little background on what this show is all about and really the catalyst for having this show. So one of the things that I was made abundantly aware of when I first got elected to state representative for the great city of Westfield in what was the 4th Hamden district seat, which is of course changing with redistricting, is that not many people know that much about what's going on with their state government. And for that matter, not many people really know what's going on with local government and federal government. They see, of course, what's in the newspaper, they see what's on the nightly news, but the real intricacies, really how a bill becomes a law, the people that are shaping policy, that are engaged in these debates on the ground floor, a lot of times folks aren't aware of that. So the thought was, let's bring that to people, hence the name, From Beacon Hill to the 413. And from what we've heard so far in the community, a lot of people are seeing this, getting a lot of positive commentary about some of the issues. It's causing a lot of conversations. People are reaching out about the topics we discuss, and I think that's a really good thing, to have with your government. I think the worst thing that can happen is there to be a sense of apathy and where people feel that there's such a profound disconnect between them and those that represent them in their respective levels and branches of government. So hopefully you enjoy this show. I think we've got a really good show. We've got a great guest, and unfortunately, this is probably a topic that many of us have kind of been diving into the weeds on, but it's a conversation that I think evokes a lot of emotions in so many different ways. And in many respects, it's a sad topic. And of course, we're talking about SUDs, substance use disorders, addictions, things like harm reduction, and we'll get into all of that. But the unfortunate reality is we've talked for many years now about an opiate epidemic. And what we are now seeing and have continued to see, as my guest is going to talk about a little bit, is that people are still dying. People are dying left and right from accidental overdoses, and it's we can and have to do better. And I am so very happy to have my guest today, and I'll give a little background on my guest today. My guest today is Liz Wynot, and she is the Harm Reduction Director of Tapestry Health. You are the Harm Reduction Director of Tapestry that operates you operate in 9 different communities in Western Massachusetts. That's awesome. And you've got extensive experience in substance use disorders and HIV and AIDS. 15 years of experience overseeing work that supports people who are in the kind of the throes of an addiction and people who are currently using drugs. And she was part of the team who advocated for and developed and implemented syringe exchange programs. I want to talk about that, both Holyoke and Westfield and beyond. And I just have to say, first, welcome.
Thank you.
Welcome. We're so happy to be here. Just by way of background, right when I got elected state senator, and even before that, the name Tapestry just keeps on coming up and up and up. And my guess is that a lot of people who are going to hear this and watch this might not be familiar with Tapestry. So why don't you tell us a little bit about Tapestry and what you do?
Yeah, and thanks so much for having me. It's really, I always love to talk about Tapestry and the work that we do because I really believe in it. But so Tapestry is a health agency that operates in all 4 counties of Western Mass, including the Berkshires, Franklin, Hampshire, and Hamden County. And there are 3 different divisions. We have a sexual reproductive health division that has clinics, medical clinics. And then we also have a WIC program that provides services to mothers and children. And then I oversee the harm reduction division, which is really working with people who are at highest risk for overdose and HIV, hepatitis C, and other transmissions of STIs. And the programs that I oversee, the goal of them are really to try to help keep people stay as safe as possible. With this conversation today with opioids and drug use, it's safe as possible while they're using drugs until they're ready to stop using, if they're ever ready. But it's really to reduce risk and improve health. And what I really like about how we approach this issue is that we try to work with the individuals that come into our sites on an equal level as much as possible. So it's really trying to meet them where they are in that moment and trying to work with them to identify the needs. A large need with people who use drugs are syringes and access to things that have a direct cause with decreasing things like HIV transmission, hepatitis C transmission, which are two things that just are easily spread through intravenous drug use. And then access to syringes and other things related to drug use help with decreasing chances of things like endocarditis or things that happen to soft tissues that are very hazardous to the individual and also quite costly to the healthcare system. And so I also like this work because it has a direct positive impact for the individual, but then it also has a direct positive impact on the local community and then the largest infrastructure. It saves a lot of costs, things like hospital visits and treatment. I think there's one quote study, or not quote, there's one quote out there that's like, if we prevent 2 HIV cases from happening a year, that equals the cost for our entire budget for 1 year for each program.
Wow. That's significant.
It is.
You have said, and I've said a couple times, harm reduction. What's the definition of harm reduction?
So how I like to put it is I just, probably like everybody else, I really wish that drugs like heroin or cocaine and other things didn't exist. I really wish that we weren't losing a lot of people to an overdose and HIV and things like that. But the reality is that the drugs do exist, and it's unfortunately here to stay in a lot of ways. And so what our approach is to not condone it, but to accept it. And
I love that.
We really want to work with the individual again in front of us to just I like harm reduction, reducing harm, but I also like to say improving health, because it's a very positive thing. It's not only trying to reduce the negative, but it's really working with that person where they're at. So somebody is not ready to go into detox, go on to treatment, that's totally fine. What we want is for them to come in and see us, and we want to identify, again, what they need in that moment. Oftentimes it's a syringe, but we also offer them Narcan and a lot of training around that. We offer them a lot of education around safer use. There's things that people can do to reduce the chances of an overdose and reduce the chances of dying from an overdose. And there's a lot of things that people can do to not contract HIV and Hep C. So that it's it's just this philosophy that's very person-centered and really goes with the saying is being kind to the person in front of us and not having an agenda.
Yeah, imagine that, being more kind and compassionate. We need a lot more of that. From your perspective, what are you seeing out there? I mean, I think a lot of people, you are the beauty of someone like yourself coming in here today and talking about this is that, I think for a lot of folks, you read about it, you see it on the news, but you are working with folks on a daily basis. So what is it? How does this work? Someone walks through the front door. I mean, how do they find out about you? But they find out about you. One way or the other, they find out about you. They walk through your door. What does Tapestry do next?
Most of the services are anonymous. So drug use, substance use disorder, with anything, but primarily heroin, cocaine is what we focus on right now. It's very, very isolating. When people are using, there's a lot of shame, internalized shame, and internalized stigma with that. So we need to be as low threshold as possible, and one way we do that is to keep the anonymity as much as possible. So when someone comes in, they don't need to tell us their name or whatever. There's no cost associated with it. We don't bill their health insurance, but we try to get them to sit down in a room with us so we can explain the services that we provide. We do take down certain demographic information so we can track the services to show the success as much as possible. And then we just basically have a conversation about like what we can offer. And sometimes when people come in, they don't trust us. They don't really know what's going on. And that's okay, because what we want is we want the person to keep coming back to us. We want to build that connection with that person. And we want to be a part of the effort and the success to reduce that shame and that isolation. Because for many reasons, I mean, I feel like as a society, there's many reasons why any of us, we can talk about how negative it is to feel isolated in a community. I mean, but for someone that used drugs, isolation increases risk of dying from an overdose. It increases risks of like doing things alone and doing things that aren't safe. So our approach is really to try to connect and provide what they need.
What are you seeing? What are the trends out in the communities right now?
It's hard. It's awful.
Yeah.
I started here 15 years ago. When I started, we were dealing with heroin. We were dealing with, if you went to a lab and tested the drug, it was the drug component heroin, and then we entered into a fentanyl epidemic, and that started in maybe around like I don't know, it started slowly, but it really, I think, not peaked, but it started to get bad in like 2016, 2017. And that's when the state of Massachusetts saw a serious increase spike in overdoses. And we've been dealing with that since, with the shift to fentanyl from heroin. Yeah. And then honestly, like in the past, even 6 months to a year, there's this new thing going on. It's xylazine. Yeah. It's my basic understanding of it is it's a veterinary drug. It's a sedated drug that's used for animals. It's not used for human use. But
it's a tranquilizer,
It's a
right?
tranquilizer. Yeah. I think it's just, I don't know why it's entered into the drug supply, but my guess is that it's probably cheap to make somewhere out there. I don't know where, but on a large scale. And there's like this shift to this because it's making the high, last longer. And it's just awful. And so what's happening now is like the problem with xylazine, which is like being put into the fentanyl, being put into the heroin, is that the person is harder to wake up. It's a very sedating drug, so it's like combined with the fentanyl. It's making overdoses look different. Now,
from a helping them out of the overdose, like an administering Narcan standpoint?
Yeah.
Okay.
So the protocol, if anybody, because we give out Narcan and want to make that very clear still, anybody can come to Tapestry and get it. And we really want people who, you can also go to the pharmacy and get it. And we really want people to please go to the pharmacy, but if you don't feel safe going to the pharmacy for whatever reason, come to Tapestry. We'll give you a kit. And then if you witness an overdose, you still give Narcan no matter what, but the xylazine is making rescue breathing more important than ever, because sometimes the Narcan with like the sedation from this new thing, it's not bringing the person out completely, like awake. It's not waking them up completely.
When you say rescue breathing, what do you mean?
It means mouth to mouth.
Okay.
So in a lot of our kits, we try to provide a rescue barrier, just, something to just put over their mouth, which is fine. But basically, if you find someone, you want to give them the Narcan, and then you want to perform rescue breaths. I believe you want to do 4 rescue breaths in between each. Gosh, why am I blanking this? I'm sorry. It's been a while since I talked about this, but it's actually, you want to give them a Narcan, and then you want to try to wait 2 to 3 minutes before giving them another dose. So in between then, you want to give a rescue breath. And it's one rescue breath every 5 seconds. That's what it is. Yeah.
Wow.
It's also it's really hard. A cool thing that we're starting to do right now is where we finally are providing medical care on the street. So we have a van that goes into like neighborhoods. We're really focusing on Holyoke and Springfield right now. So it'll park in an area where there's a lot of people that aren't accessing healthcare, and provide services to them. We have a clinician and nurses, and they're seeing also like the xylazine is causing a lot of complications with skin wounds. It's just really putting everyone through a really hard time with their physical health.
You know, one of the things I was recently, so about 2 weeks ago, I was at a harm reduction substance use conference in San Diego, and there were many speakers. And one of the things they were talking about in this is that, you know, in years past, and I think it's important too, before I talk about that, I think a lot of people, and you mentioned it, you know, years ago it was heroin, right? And then now we're seeing fentanyl, to kind of give a big picture background, if you will. And a lot of times people kind of talk about the three phases, if you will, of the opiate epidemic, where first in the late 1990s, it was really a prescription, right? It was prescription painkillers, Oxycontin, et cetera. You know, folks, you know, became addicted to that. There was clearly an over-prescribing of that in many ways. And then it kind of morphed into a heroin epidemic. And now this latest phase is now kind of what we're seeing with fentanyl. And in fact, you know, at this conference, they were also talking about, we believe, being them, kind of the experts, if you will, the folks that were there, is that we are in some ways kind of entering a fourth phase, which is fentanyl being laced with non-opiates, with cocaine, with methamphetamine. They're seeing more and more overdoses, you know, from people that are going out to buy some type of a stimulant, like a cocaine or something, and that is being laced with fentanyl or cross-contaminated with fentanyl. And it's kind of, and one of the things they talked about is what's so intriguing about fentanyl is that in many instances, you have people who just don't realize how profoundly dangerous this is, and that you literally, quite literally, can die after one time using it because you just don't know about it. And kind of on the harm reduction scale, I mean, I think a big part of it is you can't treat someone who's dead.
Yeah.
And I think that's a big part of it. But fentanyl has just made it so it's kind of just wreaking this havoc. And then obviously, and I can never pronounce it, xylazine. It's just making it. It's almost like there's always a step in front of the efforts to try to prevent. And that's just so. And that's so. It's awful. Is what you're saying out there. And bad.
And on that note, I mean, that just makes me think like there's something that just it makes the effort that we're trying to do worse. It's like we've just been heading in this disastrous direction. And so that's why I think it's more important than ever. I mean, it's been important for a while, but like our efforts need to really focus on keeping people alive.
Absolutely.
And when I mentioned that, you know, substance use is isolation is something that comes from that, there are things that we, I think, as like legislation or society can do to try to decrease that feeling of isolation. And so that might be decreasing the fear that somebody might feel if they're using, or even if they have drugs on them, or if they have something on them. It's like, I really think that we do need to go away from like a punitive measure. I don't think that arresting is gonna solve this. And I think that, like, you know, we need to just make it as safe as possible for people. And there isn't a correlation between making it safe for people and people using more drugs. You know, it's like we have been, or the state, you know, has just been arresting people and just putting people away. But we've been seeing this increase, and it continues, you know. And so it's like we have to make a change at some point, like a drastic change.
And I think it's, you know, so last week I went out with, and again, it was I got back from this conference, fentanyl, And I wanted to kind of see, that's why it was great having you on today. And I also wanted to reach out to law enforcement folks who are more in like the narcotics realm of finding stuff. And it was interesting. I did I did a ride along, and anyway, long story short, it was something that was being advertised as a large heroin transaction, but what their position was, and this is what they wanted to show me, was the pervasiveness of fentanyl, that they're going to get these drugs, they're going to test them, and they essentially said that we're going to guarantee you that it's fentanyl, that it's, if not pure fentanyl, it's going to be overwhelmingly fentanyl, just to kind of show me like what their perspective was. It's actually getting really difficult to track down heroin these days, that almost everything that they're seeing is fentanyl. And sure enough, they did it, and it was fentanyl. But then we sat down and had a conversation, and even the law enforcement perspective is, there's no way we arrest ourselves out of this. And I think this is a good thing. Many people now, to include law enforcement and beyond, realize that there's different components to this, but especially for people who are I guess in the throes of an addiction or something like that. We need to help these people, and that's why I think. And I was telling you yesterday, I was having a conversation with the Senate President about harm reduction, and it's in one of the main selling points, if you will, and that's probably not the best way to put it, is that we know with absolute certainty that people are using drugs. In fact, I'm going to take it a step further and say that, virtually every single person who's going to see this back and forth on TV, the radio, or social media, see our exchange here, has a family member, a friend, someone who probably is in the throes of some type of an addiction. That's just a reality of the world we live in. So we can either say as a society, you know what? It is what it is. Let's let them die. That's tough love. Or, and I would strongly suggest this is the better path, we can say, no, these people are sick. We need to help them. And until they get to a point, if ever, that they want treatment, we need to keep them alive or ensure that what we're doing is making whatever they're engaging in safer. And that's why I think harm reduction is kind of this new thing, certainly not from your perspective. You've been doing it forever, but it's kind of this new concept of, we know people are using. To me, harm reduction at the most fundamental level, and I'm stealing this because it's in a book I read after that conference, is that really harm reduction is radical empathy.
Yeah.
And I love that. I love that quote. The pandemic, completely changing gears, but not really. COVID. We talked about isolation a bunch here today. COVID-19 was a pandemic of many things, but it certainly, I would argue, first and foremost, was a pandemic of isolation. People kind of were told to go in your separate corners, and rightfully so, right? I mean, it was spreading, people were dying. Society, as we knew it, kind of shut down, if you will. I'm not here to debate the pros and cons of that, but we know with absolute certainty that isolation tends to lead to people, engaging in this, drugs, drinking, et cetera, and all other types of risky behavior. Did you see an uptick during the pandemic with use?
Yeah, I was just looking at the numbers. So the state of Massachusetts releases quarterly reports on the amount of overdoses that happen. And between 2020 and 2021, there was an increase. Yeah. And I think almost every single county and almost every single town. So the data did show that there was, and from what we saw is also definitely that. But our harm reduction programs were definitely affected by COVID too, and it was awful because we had to step away and not have that social connection. We had to kind of like make it much more like get people the supplies that they need, because that's number one. But we can't spend a lot of time with them. We can't, and so
that's got to be so hard.
It was
from
awful.
Your perspective.
It was terrible to go through that. It was so bad, and I feel like we're still seeing the ramifications from that. And I think it's like, it felt just it was a distraction too. It really took away from the importance of like paying close attention to people who use drugs. And it was, I just really like, I think there was a lot to learn from going through that in like a social service agency, nonprofit sector. Like, what are we going to do the next time? Hopefully this won't happen, but what are we going to do the next time if this happens? And how can we like really make services good for people, but yeah, it was the isolation part. It really does kill. It really does.
The other day, last week, a couple weeks ago, you had a community conversation in Westfield.
Yeah.
Yeah, how was that?
So Westfield has been experiencing, just like many other communities, but like a good amount of fatal overdoses. Westfield, I don't have the numbers offhand, but there's an increase in the amount of people that are dying in this community. And there's also a lot of really good advocates in this town that are rightfully angry about it and rightfully want more attention to be placed on it. And then at the same time, it was community members. This wasn't Tapestry. It was people in the community. They were posting on Facebook. They were, asking us about like, what can we do? Because I think a lot of people felt that there's no like organizing body in the town to really like advocate for their needs. So Tapestry put on a community conversation and invited, everybody, but in the people that showed up are a lot of people in recovery and also a lot of people that were actively using drugs. And so the question was posed about like what can be done differently or what can be done more. And a lot was said. I think a lot of just conversation around like how can we increase the amount of Narcan getting out into Westfield specifically. There was a lot of like people reporting that they think there just needs to be more discussion and open communication around what is Narcan. Narcan is an enabling, just the pros of it in terms of like it doesn't have any effect on the person in terms of getting them high or anything like that.
Let me just pause and stop because you just brought up a really good point.
Yeah.
What is Narcan?
Yeah. Thank you. I'm talking in like so Narcan is the brand name for naloxone, which is the drug that reverses an opioid overdose. And opioids are heroin, fentanyl, and lots of other drugs, including prescription pills like OxyContin and Percocets and things like that. So it comes in like a little spray. It reminds me a lot of Flonase, where you literally take it out of its pocket. You take it out of its package, you stick it up the person's nose, you press a button, and the spray comes out. And all it does is we have these brain receptors that heroin or fentanyl sits in and knocks it off, takes its place, makes the person wake up because an overdose of opioids, it causes the person to stop breathing. So with the Narcan going in and knocking it off, it allows the person to start breathing. And that's all that it does. It's a miracle drug. It really is.
The first time I read about Narcan and what you just described, how it knocks off like the receptor, the opiate from the receptor. I just continue to marvel at like medical technology.
I know.
How we have something that does that.
Yeah.
So I'm absolutely convinced, fact, period, end of story. I know it with absolute certainty that somebody listening or watching when this goes out will have a loved one, if not themselves, who has some type of an opiate addiction. So where does someone, even a family member, right? There's a lot of people, I've had countless constituents come up to me. They might have a grandson, a granddaughter who lives at their house. They're afraid their son or daughter is going to die. Where do they get Narcan?
Oh, they can get it from So you can first get it from a pharmacy. You can you can walk into any pharmacy and go to the counter at any CVS or Walgreens and get one that way. A lot of insurances don't bill copay, but I'm not one to talk about that. So, but if you don't feel comfortable going to the pharmacy or can't get it for some reason, you can come to Tapestry and get it. We opened a location in Westfield at 17 East Silver Street. It's over by the Big Y Plaza.
Yeah.
So we opened that location there last summer. And we're open Monday through Friday, and during our open business hours, anybody can walk in and just say that they need it, and we'll give a basic training on what it is and how to use it, and then they can take it home with them. And You can also, there's one other resource I just want to mention is called Learn to Cope. It's a really wonderful family resource.
Mention any resource you
Yeah.
want. This is Learn to Cope's great.
I do want to bring it back to this community conversation though, because the people there felt like there's not enough in Westfield. And I just feel like I have to speak for them, where they really want to see more. They want to see more attention and they want to see more organization. I think that they would really like to see from this conversation is the local government pay more attention and talk about this issue, and maybe even secure some funding for some position that can really focus on building the infrastructure for recovery and recovery and people who use drugs. It's interchangeable.
Of course.
But one suggestion was in Westfield, they really want a recovery center. There's recovery centers in like Northampton, Springfield, Holyoke, and many other communities where it's run by people in recovery, and its intention is doing a lot of programming, but really building a lot of support and a lot of advocacy. And I think that a lot of, the people that came to this really talked about just feeling lost and not feeling heard. And then they also talked a lot about just being very angry about people that they know keep dying and it's not being talked about. So I just felt it important to give voice to what.
No, absolutely. And as we talked about right before we went on, I mean, this very, well, I shouldn't say that. Many of the folks who were at this meeting, I'm meeting with tomorrow to kind of have this conversation, right? Are there any resources the state can leverage towards, whether it's beginning the conversation about a recovery center, which I think is a great idea, but even if there's an ability to get to state resources to help with the creation of a position. I agree. I mean, this is my firm belief. Every community should have someone who is a point person, right?
Yeah.
Even if it's, there are so many times, again, kind of going back to that constituent outreach from the family member, the friend, or the person who themselves is struggling. It's, I want help, or I don't want help right now, but I want to be a little safer in what I'm doing. And then I want to get help, or I do want help right now. And they don't know where to turn. And that's really, really sad that, with this many fatal overdoses, 108,000 nationally last year, many in Massachusetts. Massachusetts has been hit particularly hard. That there still needs to be, this is a conversation that I think needs to be, and this is the message that I delivered yesterday to the Senate President, is that, it's a difficult conversation, and it shouldn't be. Because, and I always go back to when I first got elected to the House of Representatives. I always tell this story, and I think it's important. Again, it's when I was in the House, and we were doing something addiction related. It was when everybody started talking about, right, this opiate epidemic, and it was a huge increase in funding on a state level. Again, to complement what's happening at the federal level, and to a lesser extent at the local level. And there started to be some pushback about the cost about it. And finally, and I give him great credit for this, the former Speaker of the House, Bob DeLeo, he kind of looked at everybody, and he kind of was nodding his head like this, and he said, look, I want you to raise your hand right now if you do not have someone close to you, family or friends, who's not struggling with some type of substance use disorder, addiction. And not a single hand went up. And then there was silence. So for a subject that's prominent, it's indefensible to not have the type of resources to combat this thing. I mean, we are losing human beings. We're losing our brothers, our sisters, our friends, our daughters, et cetera, everybody. And it's certainly something that we're going to continue to do at the state. But I agree. It's, one of the beautiful things about Tapestry is that, I like to use that military analogy, if you will. You're the boots on the ground. And in many instances, the local community is the boots on the ground. And just by the very nature of where they are in the best position to kind of combat this thing. Anything other than that at the community conversation, I want to make sure that that's out there to people.
Yeah, there's one other thing I just wanted to bring attention to. is when we talk about like keeping people alive, I think shelter and really meeting the basic needs of people is very important. And so one thing that was also talked about there is like the lack of space available in Westfield that accepts people even if they're using drugs. A lot of the shelter system in Massachusetts operates in a way that if there's any suspicion that you're even high, even if you're acting like, even if whatever, if there's suspicion that you're high, you are kicked out. You are not allowed in, which causes people to sleep on the street, and that's not safe. So there are some shelters, and I hope like there is more discussion starting that I'm hearing about instead changing to a behavior-based model. So instead of like judging the person, making a judgment because maybe, and then this includes alcohol, this includes someone whose breath smells badly, or who's just like having a hard time walking straight or something, but they're still like cordial and acting fine. So instead of like focusing on abstinence in shelter systems, a lot of places are focusing on the behavior instead. So if you're polite and you're following rules and whatever, you are allowed into the system and into the shelter, so you have a bed to sleep at night, and so you have a warm, safe space to rest your head, which ultimately also does reduce the chances of an overdose because it helps keep people connected.
So I'm going to ask a question that's going to show my ignorance. That policy, which is essentially a zero tolerance policy, is that set by the individual shelters?
I'm not sure, but in Westfield it is set by the individual shelter. And I hope what I'm saying too, I also, though, I'm not trying to like overlook all the good that's being done in Westfield, because there's just some, you and some just excellent organization community members. I've so much good is going on. And when I talk about like what I would like to see improved, I'm just trying to get to the point.
Of course.
But I just, hopefully if anybody's watching, I just want to also make it clear that like, it's amazing that we're operating here. I really enjoy the community, and I love the passion that I've been seeing to just like better the people around. We go to the overdose vigil every year that's put on, and there's just some really good efforts here as well.
Look, people are dying. I mean, people are dying. I mean, if there was ever a topic to get folks going, and to your point, I would just point out that it's folks in Westfield that are having that conversation,
it is,
right? And then
and
there's they're mutual friends of us, acquaintances that I've certainly known for years. Many of them my friends that are we need to do more. And again, that's going to be a big part of my tomorrow meeting with them. It's essentially going to be, what can we do at the state, and how can I help influence, if you will, stuff happening at the local level. It's not. I mean, the uptick in fatal overdoses it's if there was anything that should cause a lot of people to say, really, because not really. That's awful and we need to do something about it, because as I've started to recently talk about it, and I think this is a big problem, is that there's also a lack of awareness.
Yeah.
Right? There's just a lot of people, when I've heard some of these numbers, in fact, yesterday when I was at the State House, when I said that, that's a serious uptick. And again, it's Westfield, it's beyond. But people are dying. People are dying, and a lot of times, it's, and I guess I want to use this to transition. Like, I'm not sure your average person, notwithstanding all of the remarkable efforts of groups like Tapestry, things that are happening with community conversations, realize just how dangerous it is out there with everything that's going on, particularly as it relates to fentanyl. So for many reasons, we need to highlight that, to respond to it, to prevent it, to get them help, harm reduction or otherwise. But it's also, people need to know, so they realize like what's at stake here.
Yeah.
And it's, I remember this Dr. Sarah Wakeman. She's a doctor. You ever come across Dr. Wakeman? She's a big harm reductionist. She's at Mass General Hospital, and they're kind of trailblazing nationally this effort of, treating the person, the entirety of the person, right? Like if it's, a lot of times we know with data that if someone is struggling with something, a substance use issue, that, there's also going to be a housing issue. There's also going to be a mental health issue. There's also going to be a transportation issue, a lot of co-occurring conditions. And it's, all right, we can't just treat substance use as like a separate silo from everything else, because we know that if this person, this individual, to your point about shelters and having a place to lay down at night, if certain basic needs aren't met, treating the substance use issue is going to be incredibly harder.
Exactly.
And she's really leading in that field. And I lost my train of thought of why I brought her up, but she's a huge believer in this kind of this harm reduction. But when you come in, it's, hey, you're going to talk to this person about housing, this person about transportation. Oh, a study that she came out with an author in conjunction with Harvard was that, the data supports that at some point in time that folks, in some instances, and I don't have the numbers in front of me, many people grow out of a substance use disorder. Many people grow out of it.
Yep.
But she said the problem is that it's so dangerous out there right now versus years in the past. And it's always been dangerous. But what fentanyl has done is it's made it so people that we think at some point in time may have grown out of this, they're not alive. They're just dying, which to me all points back to harm reduction and what Tapestry is doing and why this needs to be part of the mainstream discussion about what we're doing.
And I'll just put myself out there. So, like in 2012, we opened the Holyoke site. It was the Holyoke Needle Exchange site, and it was kind of groundbreaking in that. And there was a lot of pushback to try to get it shut down because there's just a lot of controversy around it. And
the Holyoke Tapestry site.
The Holyoke Tapestry site, yeah. And so back then, I really, saw that the efforts to shut it down were based in like stigma and really like other, the people that were coming and seeing us and getting help weren't even considered people in a lot of ways. And I think there was just like a disconnect. And so at that time, I decided to publicly come out with my own story that I used to use heroin and I used to go to the Tapestry site in Northampton. And
It takes a lot of courage.
I really don't think that, like, looking at me today, anybody would assume that. And so when you're talking about growing out of it, that's kind of what happened with me. And I am so thankful that I went through what I did then and not now, because there's a much, much higher chance that I would be dead. And if it wasn't for programs like Tapestry that helped me back then, like I don't know where I would be now, And so here I am. And so I decided at that time to publicly come out and say that, because it's like, when you talk about people coming to Tapestry, you're talking about me, you're talking about like potentially your daughter, your sister, your friend that you have no idea what's going on with them. And they are so isolated and they are so alone and they need care right then. And I think that that's another important aspect of it, because it's like we really need to help the person without judgment, because we don't know what that person is going through. And we don't know where that person will end up 20 years, 10 years, 5 years, whatever, tomorrow, And so it's like we need to keep people alive, and that needs to be the most important thing.
I mean, the preservation of human life, is there anything more and just remark, I think that's so cool how you just did that. And I think it's really important what you just said. I mean, there's a lot of people, myself included, I've said it here on this show before when we've talked about this topic. I hear it all the time at recovery meetings and stuff like that. People saying that if I were out today, I would be dead.
Yeah. Just
be dead. That's how dangerous it is out there. And I just, in that vein, I want to touch on this because I think awareness on this. Can you speak a little bit about what you're seeing or hearing about kind of these, which was the subject of actually where we are at Westfield, the Technical Academy, the DA, as well as many groups, Tapestry included, came together for a community conversation or presentation on the dangers of pills that are, filled with fentanyl today and what's out there. Because I think this is something that's critical for people to hear.
Yeah, so it's not just heroin that fentanyl, like I think you mentioned that earlier in the show, that fentanyl is making its way into. It's also making its way into counterfeit pressed pills. Yeah. So pills like Percocet or like Adderall or like Oxy or any of the drugs that I think have been for a while, kind of like drugs that adolescents can get their hands on or something, or people in college or people whatever, people just whoever using press pills, that there is the potential for fentanyl to have been contaminated. And a lot of times when you're buying a pill off of someone, it's not coming from a pharmaceutical company. It's not coming from a doctor. It's coming off of the black market, and it's being made underground wherever, and you're not really getting what you think you're getting. So that is even more important for harm reduction, to be trained in Narcan and to just really understand that. And so the angle that we take with that is that it's just important for everybody, including people who are under 18, to get the education and know like what they get their hands on might not be what they think they're getting their hands on. And so you need to know that there is a potential for fentanyl. There is potential for other things to be in that pill. You need to watch out for your friends, and your friends need to watch out for you. And you should have Narcan on you. You should maybe learn how to use fentanyl test strips. And you should really just know like the signs of an overdose, and know like how to pay attention to the kids around you that might ingest something. And if they pass out, know what to do in case that happens. And I think that does provide an opportunity for more education and more understanding, and hopefully like will result in a shift in how we are educating people.
Yeah, and I think that's so important because, to your point, whether it's Oxycontin, Adderall, Ritalin, the type of, those are the, to your point, adolescents and beyond, things that people are interested in. And, at that same day that I was with law enforcement last week, they had just made a big Adderall bust that was methamphetamine. It had all been stuffed with methamphetamine and fentanyl. And the gist of actually now to the conference that I went to was, a really across-the-board good, black letter law, guidance would be, unless you go into the CVS and Walgreens and get it yourself, or of course from a loved one, something like that, picking up your prescription, you need to assume that there could be something. And where we're seeing a lot of this, and I'm hoping that parents and others are paying attention to this, is that there's just been a proliferation of a lot of these transactions happening online and in social media and Instagram and TikTok and all this stuff. You can press a button and have a pill delivered that you think is fill in the blanks, and it's really fentanyl. So those counterfeit press pills are really, really getting to be a big thing. Just want to touch on one. There's been just so much information, and we could spend hours talking about this. There's a lot of back and forth in Massachusetts and beyond about the pros and the cons about, safe consumption sites, overdose prevention sites. They go by so many names.
Yeah.
So just to ensure that the viewers know what we're talking about, and correct me if I completely don't give a good description of this, but it's a place where folks can go to use their drug of choice, whatever it may be, but to do it in a safe way, right? So there's Narcan available, there is clean needles available, and most importantly, there's people available who are going to talk to you about support services in whatever form, not just about treatment, not just about not using, just about your overall health. thoughts on that, because that is a policy discussion that we will absolutely be talking about in Beacon Hill.
I mean, I feel like everything we've talked about today is the background reasoning of why you need overdose prevention sites, because again, like one of the main one of the highest, like most likely reasons why someone will die from an overdose is because they're using alone. And so anything that we can do to stop that from happening is worth it to keep people alive. And overdose prevention sites are one of the tools, one of the things that we need to help that to happen. So at Tapestry, we have our site. We meet people. We educate them. We're building this trusting relationship. We're providing them with Narcan and testing and referrals, and we're also providing them with syringes and education around to use safely. But then they leave and they have to go use somewhere, and it's like very likely a lot of people, I think, in towns like Westfield or the surrounding towns, a lot of people are using in their bathrooms, they're using in their bedrooms, they're using maybe in a gas station bathroom or something. Yeah. They're using alone, and it's because, like, again, it's a very isolating, lonely place, like to be you injecting a drug. And so an overdose prevention site, like if Tapestry had that option, we could keep that person there and they would be able to consume their drug in our safe and clean environment under the supervision of our dedicated staff. And they would be able to be, educated around safer use. And then if they've, unfortunately did overdose, we'd be able to reverse that overdose right there. And then with that connection, we are able to provide referrals to treatment if and when they're ready. We are able to just have discussions around improving the health. And so it's just such a holistic, and like, it's the missing thing from programs like ours. And it's just needed, and they exist all over the world. There's a bunch in Canada, and there's a bunch in Europe and other places in the world.
Well, now in New York City, too.
Oh, yeah, that's right, in New York City, yeah. Thank you for that reminder.
And the state of Rhode Island just passed a law, so they're in the process of doing it. I have a question for you, and I want to be very clear here. This is not, I am playing the role of devil's advocate here, and I want to throw this at you because the constant refrain you hear from folks who are not in support of overdose
prevention sites.
Why? Well, I cannot. There are so many words, and I'm saying to myself, all right, which one am I? Overdose prevention sites. And I want to be very clear here, again, to you as well as the viewers, that is not a persuasion that I share, but it is what is constantly brought up. Why are these not rewarding bad behavior and enabling drug use?
And I think we can build a connection of, like, why isn't Narcan rewarding behavior or enabling drug use? Why aren't syringes rewarding behavior and enabling drug use? Like, I feel like my way I learn is I associate it with something else that might be relative. So, like, the act of giving something what they need, the act of providing a safe space, it doesn't enable the behavior because, again, they're using drugs, and it's unfortunate. It's I wish it was different, believe me, but that is what's happening. So it's we're enabling them to, like, not have to go use in some dirty gas station bathroom. We're enabling them to live another day and providing a safe space for them to be. And there's, like, there is research out there that does demonstrate that there isn't a link between increased use and overdose prevention site, just like there's a lot of evidence showing no increased use, but for the individual or for the community with syringe access, and especially, or Narcan. So it's just that. It's the reality. And I really like, you've come to our Holyoke site at least. And, like, we it's nice to have people, like, come to our sites or see what we do to really get, like I feel like when you see it, it makes a lot more sense, because I can respect that it's, like, hard. We all ever, if you don't know it, if you don't see it, it's kind of hard to get it. But people are using and people are dying.
I mean, that to me is like we are at a crossroads as a society, and this is kind of the way that I look at it in my mind. It's that if we want to say as a society, anybody who uses drugs we don't care what happens to you, if you die, whatever. And I would say that not only is that inhumane, it's absolutely certifiably insane. But if you're not in that group, then these sites make a heck of a lot more sense. And you talked about, for any number of reasons, and then you said it, and I just want to highlight it too, because I feel like this is less talked about in the why this is a really good idea. And it's because at some point in time, it's widely known. I think you want to meet people where they are, kind of in the recovery space. Everybody's time is different. Relapse is a part of it. But there's also, when you go there and you're talking to someone, let's say they're talking to you, maybe at some point in time, you'd say, hey, if you ever have an interest in, not doing this, or there are treatment options available. So I guess what I'm saying is that, there will be people that make a decision at these sites based on relationships they form there, where they say, you want to know what? I'm not going to do this anymore, or I'm going to try not to do this anymore. And I think that's a really good thing. And for whatever reason, I think that plays less of a prominent role in this debate than it should. It's that we know with absolute certainty, based on where it's going on in other parts of the world, Canada, Europe, that it's also a pipeline to treatment. And I think that's a really important part of the discussion.
It is.
I mean, it's obviously a distant second to keeping people alive, but it's.
But it actually, though, when it comes to treatment, I think one another thing to keep in mind for policy or legislation or something is our treatment system really needs to be revamped.
It does. I agree.
So to get into inpatient detox, which is a really important form of treatment, you have to make a phone call. You put on a waiting list. It can take days, and it's a broken system. It's very hard, especially if you don't have a phone, if you don't have a stable living, if you don't have food to eat, it's hard.
Yeah.
So we need to get people treatment when they need it. And that's another thing of we don't provide the detox, so we help people get into this broken system, but we're still helping, and we still make it easier for them to go. So it's we want to be there at that moment when they want treatment, and we need to get them as quick as possible. So that is an important part of it. It really is, because it's a step in fixing this broken system.
The number of people, I shouldn't say the number of people, but I have had instances where I've had to hear from a family member after their loved one dies, and I will just say, I'll make up a name, Sarah or John, made a contact, reached out to a treatment facility, wanted to go to detox, and was told, you may have a bed in 48 hours, 72 hours, call back. To your point, housing was an issue. And anyway, long story short, that person used again and died of an overdose.
Yeah.
And that's just the wrong answer. There needs to be some way when someone does what I think is one of the most courageous things a human being can do, which is raise their hand and say, I need help and I'm ready to get help. Call back in 72 hours, to me, is just not the right answer.
It's not.
And we need to do better. So that's another huge policy thing. Last thing, and I've said this 5 times now, anything we can do. Well, what's out there? Stigma. Stigma. It's going to throw an easy one at you, as we finish up. But just, what can a viewer do to help reduce stigma? Someone who's not in this line of work, what can a viewer do?
That's a lot. So stigma, there's different levels of it, and it to me it means the words associated with stigma for me right now mean, again, internalized stigma, shame, and that isolation. And then it's also, there is stigma from institutions and everything, and that translates into different forms of discrimination, and you might not even know that you're doing it. It might mean that person looks dirty, that person we see a panhandler on the street. Yeah. We're not letting someone into the shelter because they're obviously drunk. It's just there's like, you know, I don't know. It's just like we need to put the person before the behavior. So like at Tapestry, you know, when you talk about like the progression of language, I think addict is a commonly used term for so long, but then it like addiction, and now the right word is substance use disorder, or we say an addict, but like, you know, for my own language, I try to say it's a person who uses drugs. It's a person who has substance use disorder, and always putting that person first. And
I like that, person before the behavior.
Yeah. And so, like, as an individual, the more that we can try to do that, I think, like, and just try to be aware that we might need to start doing that, the better. And then I also think, you know, just with something that Narcan is much more easily, I think Narcan is much more accepted now than it was 10 years ago.
Absolutely.
So at this community discussion, like the people there really want to see more Narcan in the community. They like to see more people trained. They like to see people more, you know, just aware of it. I'd love to see every McDonald's and Dunkin' Donuts and Cumberland Farms carry Narcan. And that's a tough one, that, you know, but like the more that we can just be out there and talk about it and educate it, the less like secrecy there will be, and like the more acceptance there will be, and the more like somebody that might be using drugs and having a tough time, the more that like they might be able to get help at that moment. So I mean, we could talk for 2 hours about stigma, and I'm happy to. You know, those are just
and then I
things
think
that come to mind.
I think you know, this is my thoughts anyway, just a general sense of empathy that, you know, someone with a substance use disorder is you. And what I mean by that is, you know, but for the grace of God, you know, there goes I, there goes my family member. And I think even on that level, a much more fundamental level, just, you know, compassion and kindness. I think in this area and so many others, we need a healthy dose of compassion and kindness, because it truly is, you know, one of the remarkable things that I love doing for any number of reasons, many of them personal, is sitting down with someone who's kind of in the throes of this, and kind of talking to them about, you know, their journey. And they're remarkable human beings, and they're not lesser than human beings because they're dealing with what they're dealing. But to your point, I mean, just here today, you know, I have used substance use disorder, addiction, addicted interchangeably. And I consider myself a lawmaker who is trying to lead on these issues. So it's, to your point, I would say that. Liz, I can't thank you enough. I can't thank Tapestry enough for what you're doing. You know, for those who don't know about Tapestry, check it out. Literally saving lives on a daily basis, helping people, keeping people safe. And this has just been a phenomenal conversation, and we will certainly be in contact. And I will let you know how that meeting goes tomorrow that I have with a lot of those Westfield folks from that community conversation. And to everybody, hopefully you found this useful. Merry Christmas, Happy Holidays, whatever you celebrate. Please enjoy, please be safe. And we will see you next month for another episode of Beacon Hill to the 413. Have a great day, everybody.